When I take care of my health care issues, what have you, if I have a problem with my feet or anything like that, I normally go once or twice a year because I work in a computer field. Sometimes you get your foot run over or something. So I came in because I thought I had a fracture, but it wasn't a fracture. What happened was it was a bunion. So I couldn't go to my other doctor; they closed, what have you. So I had to choose another one. So I chose, and he actually helped me out with the bunion. And she showed me that it wasn't a fracture or anything; it was just a bunion. So he told me about the procedure that he was going to give me, as far as to give me take off some bone and hopefully shave down the bunion, and so far I'm healing properly. I think it was a quick service. I had to decide what I wanted to do. Also, I had other things I needed to do also, because once a year I try and see if I have any nail fungus, I try and get rid of it. But my other foot doctor couldn't, they just gave me cream or what have you, so I decided to take a different approach. And he suggested the approach and everything as far as the laser treatment, and I decided to go with that, the bunion and the nail removal on this foot.
We're looking at a little screw put in his big toe. Since he has a big bunion, had to shave down the bone spur and put a little screw there. Okay? My name is Dr. Emmanuel Fuzalov. I've been practicing since 2002. I've been trained for numerous years to treat foot pathologies with by the plastic surgeons, okay, with the minimal invasive approach. It means that we do use very small incision to create little holes in the skin to create major foot pathologies, including bunions, hammer toes, heel spurs. So I do around 400 or 500 surgeries per year. My patients vary from nurses, doctors, police officers, teachers, and most of them do come with the same issue. So the biggest challenge I face every single day is explaining the patients their misconceptions about what the foot surgery is. That to do the procedure to fix the bunion is only 4 to 5 weeks to wear a surgical shoe. You don't have to stay home in 5 to 6 weeks. You don't have to be off your foot. You can basically do the procedure, go back to work next week, as long as you wear a surgical shoe. Many people don't understand this. They think it's a much longer time. They think it's impossible to heal within a month of 6 weeks. And with that misbelief, they leave with their pain. The major issues that people have with their feet, they coming from wearing wrong shoes, high heels, shoes without arches, is when they go to the pedicure salons, they get infection from the tonal fungus. Okay, those things, because they have a lack of knowledge of how to prevent those pathologies, they get infected, they get bunions and hammer toes. So my job as a doctor is to prevent it, and if they happen to them, to take steps to get rid of those pathologies. Tonal fungus is another big area of my expertise that I successfully treat for past 7 years with the so-called pinpoint laser treatment, which is an FDA-approved treatment of the tonal fungus, which is done here in the surgical center facility. It takes about 5 to 10 minutes, and you see excellent results within 4 to 6 months.
Okay. I'm Dominique. I am a patient of Dr. Fuzalov. I came because I was having pain in my ankle. I met Dr. Fuzalov. He had very great bedside manners, very nice. I had a minor procedure where he went in and fixed the bone, a little fracture that I had. I had very minimal swelling. I healed really fast. He's a great doctor, and I really recommend him to any patient that has or needs any type of foot reconstruction or any of those sorts.
Corns in the toes is the most common thing people come, and tonal fungus. The third most common is heel pain. People do have heel pain from numerous reasons. The major reason is their weight. They gain weight, they stand a lot, they wear shoes without arch, or they flat-footed. So that triggers heel pain or some so-called heel spur syndrome with or without plantar fasciitis. It's a very common thing. People think that that cannot be treated. That's another misconception. And I do treat this in my office with another very small and non-invasive procedure called a radio frequency nerve ablation, which is a pain management procedure. It's created by neurosurgeons when I target the painful nerve and ablate the nerve to get rid of the symptoms. It's usually covered by major medical insurances, but if the patients do want to pay out of the pocket, they don't have insurances, I'm always open for negotiation. I expand my practice now. I do have a practice in Brooklyn, but I expand it now to area of Flatbush Avenue, where I see another high demand of people with the same problems. Those union workers who wear steel-toe boots, they have major problems like with the hammer toes and bunions, and I hear those stories all over again. In my future, I'm planning to create a team of doctors who will operate under my entity, with all my knowledge, and treat patients not only for bunions and hammer toes, but all other foot pathologies. Seeing me in my office is to see an expert who is very confident with all his knowledge, who has multiple years of experience, multiple patients who did have bunion and hammer toes and heel spurs surgeries done, and I put all my expertise and all my knowledge in your hands.